This is a very important topic in this conversation, and that is the affordability of mental health services, also the accessibility. Just give us an overview of where that is right now at the moment.
You know, this country has changed and changed fundamentally. A good example is the NHIF. And even as this country goes towards universal health, NHIF is already covering the costs of mental health services in this country. And not just the mental health services, that includes rehabilitation services. That means a person who has a NHIF cover can actually go for a full rehabilitation free. All right? And that means that a large number of Kenyans now are able to access these services and therefore the base of care in this country. So, when we say that our country is moving forward, it is factors of that nature that are dramatically changing the landscape. Mental health issues can be addressed at all levels of the medical service. You choose whether you want to go to the top-notch hospital or whether you want to stay in your local services. I would say this: do not fear. If you're depressed, if you can't sleep, or if you have any other kind of mental illness, do not be afraid of going to your local hospital. You will enter the service and you will get the service you require. Kenya is ahead of almost everybody else in Africa in this particular regard. In terms of mental health specialists, psychiatrists in particular, or psychiatric nurses and so on, we rank high, we rank well on the number of psychiatrists per population. Does that mean Kenya has enough psychiatrists? No. It means we have very few, but more than most other countries. That's one. Secondly, in terms of the spread on the ground of psychiatric services, the first port of call has to be a government hospital. And the good news is that it doesn't have to be a specialized psychiatric hospital. We have, across the country, men and women who are trained in psychiatry who have been posted throughout many of the counties. But even if you don't get to a county hospital, to a county referral hospital, and even the lower level, there's a lot of training and specialization amongst the clinical officer cadre. In a nutshell, therefore, wherever you are, whether you're in Nairobi, whether you're in Machakos or whatever it is, when you feel you have an illness that is mental, go to the nearest hospital and you will find yourself going through the system.